So let's cover them. You tell me which one you want to start with, but I think it'd be helpful to let the audience know about some of these exciting high-grade agents too.
Yeah, I think we'll start from the cheapest. How's that?
Yeah,
We'll start
great.
with gemcitabine and docetaxel, which in some, although the data, like I said, right now is retrospective, they looked at patients who got gemcitabine docetaxel and their 1-year recurrence-free survival was 60% for high-grade non-muscle invasive bladder cancer. So relatively comparable to the data that we have for BCG. When you're looking out to 2 years, it was about 50% recurrence-free survival. And again, that was all collected retrospectively. It is ongoing, being compared to BCG directly head to head, which is awesome. Like, I salute them for doing that comparison in the bridge trial. And I think the results of that will be really exciting. I hope that it will show us something like that it is either equivalent or non-inferior, because there are practices who when they can't get any BCG, they're using gemcitabine docetaxel induction course as their primary treatment. And I think that's kind of the most common de facto substitute right now.
Yeah, agree. That's what I think. So I think that's accurate. I know sometimes I'll use gemcitabine docetaxel in patients who I want to get intravesical therapy, but they may be immunocompromised, or
Yes.
there may be some other contraindication to BCG. So I love having that in my back pocket.
Completely agree. And it is reasonably priced relative to all the other things out there, and given in a very similar method that we're very comfortable with as urologists, weekly for 6 weeks kind of thing. It does take a little bit more time in clinic, which than BCG, because of the sequential dosing. But I think overall, it's a great option as an alternative to BCG. Even if there was, if there is a shortage, is not a shortage, it can be used in BCG refractory patients, but also with shortages.
Yeah. And now there's some other drugs. Like, what I'm really fascinated by is TAR-200. And the reason is it's not a new drug, right? So it's like getting creative with a mainstay gemcitabine, which we've talked about a few times, but it kind of bridges this idea of like delivery system, dwell time, the exposure to the affected mucosa, all of that. So what are your thoughts on TAR-200?
Yeah, I think your point about the dwell time is key. So BCG, gemcitabine, docetaxel, we say hold for 2 hours, 1 to 2 hours, please. And then they void it out and it's gone. And the TAR-200 really captures the idea. It's a little mini pretzel that is put in the bladder cystoscopically or with a catheter. Placement is confirmed cystoscopically, and it really it stays in for 3 weeks, and it's slowly long dose, almost like extended release form of gemcitabine is emitted into the bladder. And that was studied primarily in a BCG refractory population, but they had a really excellent response rate in the BCG refractory population. They also are doing a trial looking at in the BCG-naive population in Sunrise 3, comparing it to BCG, which I think also will be interesting. Again, it's given via a little catheter that's put in, and that thing floats around your bladder and it prolongs the dwell time. And I think their thought is, well, if the dwell time is longer, will the outcomes be a little better? We don't know that answer yet, but we do know it works well in a BCG refractory population. And I believe they submitted to the FDA, and where we're waiting to hear approval for the BCG refractory folks.
Yeah, and I think eventually if they can prove either superiority or non-inferiority to BCG, the interest in the naive population, I think the interesting thing will be avoiding that weekly clinic visit potentially.
Yes.
And like for patients who, again, there's a shortage, right? So some of these people have to drive like 4 to 6
Absolutely.
hours, especially for us and being in Nashville and having a lot of rural areas around us. I think that'll be a nice option for folks.
Completely agree. The dosing convenience will be great.